Member Week is here at Lowe's. Don't miss your chance to get up to 40% off hundreds of items like paint, outdoor and home essentials, and more. Shop our exclusive deals happening in-store and online now through May 14th. Not a rewards member? Join for free today and get ready to save more. Lowe's, we help, you save. Loyalty program subject to terms and conditions. Details at lowes.com/terms. Subject to change.
The spirit of innovation is deeply ingrained in America, and Google is helping Americans innovate in ways both big and small. Central Texas Regional Mobility Authority is using Google AI to create smarter tolling systems and improve traffic flow for Texans. This is a new era of American innovation. Find out more at g.co/American Innovation.
Have you seen social media posts about weight loss drugs? It's kind of disturbing to me that these medications have already trickled down from being a treatment for health conditions that carry significant consequences to basically a beauty product. There's no doubt that these medications are going to change the course of people's lives in terms of their health, but it does leave me wondering, what impact is this going to have on our concept of beauty, on kids' self-esteem, our self-esteem, on how the next generation, our kids view weight and body image? We just don't really know. What we do know is that our kids should not be seeing TikTok videos of women talking about weight loss at all. And as strange as I think all of this is, I don't experience these issues among kids firsthand, but one of my pediatrician colleagues is grappling with this. Here's her reaction to what's going on.
It's very upsetting because I'm really these medications are very helpful for kids, adolescents who have severe obesity and they have no other options to really help treat this chronic disease. And it's not about weight
being
reduction
a model thin,
and being a model and thin and all of that stuff. It's the health focus. And so I really hope that we can somehow counter the negative impact that these medications can be having on a societal level, because there's all of this misuse of the medications.
That was nutrition and wellness expert Dr. Natalie Muth. Next, she'll share how these medications work and when and how to use them in adolescence. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kids' health. I mix the science of medicine with the reality of parenting. Fellow pediatrician Dr. Natalie Muth is also a registered dietitian. She has a master's degree in public health and her MBA. And yes, she went to my medical school, as a matter of fact. She's a pediatrician, and the focus of her career has been to provide the support that kids and families need to have a healthy lifestyle and to treat the medical consequences of overweight and obesity. For much of her career, she has focused on lifestyle factors, and she's going to continue to do that. But now there are other options for weight management. When does it make sense to move beyond lifestyle changes and to consider using obesity medications in kids? In my career as a pediatrician, I've seen our focus as doctors treating kids really change to be more proactive about addressing weight issues in younger kids. We really didn't address kids' weight all that much, and definitely not as effectively in the past. But now we have a lot more treatment options, and we know more about what works to help kids be a healthy weight. I asked Dr. Muth if she has noticed a change in the way we take care of these issues.
In the past couple of years, we have evolved our understanding of adolescent obesity, especially, and also have more options for treating it and treating it early in cases where there really is a high risk for there to be significant negative physical and mental health comorbidities or related conditions that go with the obesity. So medications like GLP-1 agonists are approved for adolescents 12 and older who have obesity. In my experience and kind of the process that we go through and kind of deciding whether or not to start an adolescent on an obesity medication is related to the severity of the obesity. For many adolescents who have very significantly elevated BMI, it doesn't matter how much behavioral intervention you do, you can really positively impact their health. You are not likely to cause significant decreases in weight that is sustained over a long period of time to the point where they don't have obesity anymore with lifestyle alone. It's just been looked at again and again, and it's really difficult because there's often many strong genetic factors that contribute to that. There's also something called like a set point weight, which a lot of adults may have experience with, where you lose weight and your metabolism changes because your body's trying to actually get you back to a set point weight that it thinks it's supposed to be at. And so you may lose weight, but you gain it back. And there's a classic like check mark of weight loss interventions that are behavioral, where people lose weight and then it comes back. And it's not because they gave up on the eating plan or couldn't stick with it. It's because there's real physiological changes that are getting in the way of being able to sustain that weight loss. Prior to having medications, the only way to really like do the reset of the set point was bariatric surgery. Mm. What we are finding with the medications, if they're continued, which is a big thing, they seem to be lowering weight in a significant way that can be sustained if the medication is continued. If the medication is stopped, in many cases, the weight comes back on, probably because it's not changing the set point. And so that's important because when you're thinking about starting an adolescent on a medication, the conversation has to include, like, this very well could be something that you're on, whether it's this medication or a different one, but it very well may be something that you're on for a long time, maybe the rest of your life. The changes that come from this medication can be quite significant. If you stop the medication, it's likely that things will go back to how they were. And so in many cases, especially if you have kids who have no comorbidities related to the obesity, they barely have obesity, their BMI is not that high, you don't really necessarily want to take that big jump right now. Maybe it's not necessary. In some adolescents where they have more severe obesity, they're already looking like they're going to get type 2 diabetes, they already have significant fatty liver disease or very elevated cholesterol that's increasing their risk of having a heart attack at a young age. These are serious things. Then you are in a place, you have that conversation with the family and they're like, yes, this is something that's important to us because we want to address this now before these health harms can have longer to take hold and increase the child's risk down the road. And then we start it and we have options now that we didn't have before. And they are really game changing for a lot of adolescents, especially those with more severe obesity.
Is it just the GLP-1 agonists or are there other medications?
There's 3 medications right now that are approved for adolescent obesity. 2 of them are GLP-1s. We don't really use the shot every day. One doesn't work as well. And it's a shot every day. It's not great for kids or teenagers. So there's really one GLP-1 agonist we're using right now for adolescents. And then there is a FDA approved for 12 and older oral medication that is a combination of 2 medications, phentermine and topiramate, that seem to work together in a way that's safe and effective to help contribute to decreased weight. Not to the same extent as the GLP-1 agonist, but still pretty significant. The thing that's a major consideration for that one is it does seem to impact growth. So when you're looking at starting that medication, you really want to be looking at, teenagers who already have had most of their growth happen, which tends to be the females, as a lot of the adolescent males are still growing or haven't hit their growth spurt necessarily yet. And that one is, it's teratogenic, meaning that it can cause health harms if a adolescent female were to get pregnant. So you have to be like extra aggressively monitoring that, making sure that they're protected from pregnancy. There's some labs you have to check. So it requires a little bit more monitoring than the monthly injection, but it's a great option and a more affordable option for a lot of families.
But that one's interesting because severe obesity will also potentially make you not grow as well. So there's got to be a point at which that makes more sense to go on the medication. Plus, phentermine and topiramate are both very, very old medications. They've been around forever.
They have, yeah. And it was kind of found by accident how they work together to be able to kind of impact weight this much. Phentermine itself was approved for 16 and older for 3 months only to be used for weight. And then this combination, phentermine topiramate, got looked at and found to be effective. And yeah, you're always, and to your point, every child or adolescent that we're working with, it's a very individualized decision and weighing of risk benefits and unknowns and making the decision of what is the best option, either what medication is the best option, what timing is the best option, what treatment plan overall together is the best option. And it varies a lot based on an individual child and family and kind of where they're at and what's important to them.
So the GLP-1s haven't been approved for kids for very long, but they've been around, I think, longer than I suspect. How long have they been around, or what were they used for?
So GLP-1s typically have been used for diabetes, and they've been looked at for diabetes. And one of them is approved for 10 and older for diabetes. It was kind of found by accident that, hey, these GLP-1s are actually contributing to weight loss. And then it was found, at first you had to there wasn't a longer acting GLP-1. So it was like something you had to keep taking often, which is why there was the first available one. It's like an injection every day because they hadn't figured out yet how to make it be longer acting. And then kind of happened upon that with a longer acting one approved for diabetes, and then finding, which, most people talk about Ozempic, for example, that's actually just approved for diabetes, but it was found that in a higher dose of it, which is what the dose that's approved in a different name that's approved for obesity, that actually contributed to pretty significant weight loss.
How do these medications work? Are there side effects? And what should parents know about medical weight loss options for kids? That's up next.
Summer's here, and Nordstrom has everything you need for your best dress season ever. From beach days and weddings to weekend getaways and your everyday wardrobe. Discover stylish options under $100 from tons of your favorite brands like Mango, Skims, Princess Polly, and Madewell. It's easy too with free shipping and free returns, in-store order pickup, and more. Shop today in stores, online at Nordstrom.com, or download the Nordstrom app.
Eczema isn't always obvious, but it's real. And so is the relief from Ebglyss. After an initial dosing phase of 16 weeks, about 4 in 10 people taking Ebglyss achieved itch relief and clear or almost clear skin. And most of those people maintain skin that's still more clear at 1 year with monthly dosing.
Ebglyss, lebrikizumab LBKZ, a 250 milligram per 2 milliliter injection, is a prescription medicine used to treat adults and children 12 years of age and older who weigh at least 88 pounds or 40 kilograms with moderate to severe eczema, also called atopic dermatitis, that is not well controlled with prescription therapies used on the skin or topicals, or who cannot use topical therapies. Ebglyss can be used with or without topical corticosteroids. Don't use if you're allergic to Ebglyss. Allergic reactions can occur that can be severe. Eye problems can occur. Tell your doctor if you have new or worsening eye problems. You should not receive a live vaccine when treated with Ebglyss. Before starting Ebglyss, tell your doctor if you have a parasitic infection.
Searching for real relief? Ask your doctor about Ebglyss and visit ebglyss.lilly.com or call 1-800-LILY-RX or 1-800-545-5979.
This episode is brought to you by State Farm. Knowing you could be saving money for the things you really want is a great feeling. Talk to a State Farm agent today to learn how you can choose to bundle and save with the Personal Price Plan. Like a good neighbor, State Farm is there. Prices are based on rating plans that vary by state. Coverage options are selected by the customer. Availability, amount of discounts and savings, and eligibility vary by state.
How do meds like Ozempic and Wegovy and all the other ones work? Well, as you probably know, they were first manufactured for adults that had type 2 diabetes, but now you're hearing people talk about them for weight loss in adults. So what are these medications really doing? And why are some doctors using them to help teens with obesity? Well, okay, here it is. It all starts with a hormone in your body called GLP-1. That stands for glucagon-like peptide 1. GLP-1 is a hormone that your body makes naturally, especially after you eat. It makes more of it then, and it helps keep your appetite and your blood sugar in check. It does 3 primary things. It tells your brain first, hey, you're full, stop eating now. That's the signal it sends. It actually slows down the movement of food through your stomach so that you feel full longer. And that means you have fewer cravings and a lot less snacking. Second, it helps your pancreas to release insulin. That's the hormone that keeps your blood sugars level and steady after a meal. So not only are you eating less, but your body is also handling sugar more efficiently. Okay, and third, it keeps your liver from releasing too much glucose or sugar at one time. So now, GLP-1 agonist medications like semaglutide, which is the main ingredient in Wegovy and Ozempic, basically mimic this natural hormone and turn up the volume on it. Your body starts getting the message loud and clear that it's full, your stomach is full, so it's easier to eat less without feeling hungry or uncomfortable. People who take these medications lose a significant amount of weight over time, but not because the medicine is melting fat, but because the person just doesn't feel as hungry. They don't have that need to eat as much. They think less about food too. And when you eat less over time, obviously the weight comes off. Doctors usually only prescribe these medications to teens or adults who really need help losing weight in order to treat the health consequences that are linked to their extra weight. Things like diabetes, high blood pressure, or, sleep apnea. And yes, these medications do have some side effects, especially nausea. That's the one I hear about the most. And people have to take these medications ongoing, long-term, in order for them to continue to work. Here, Dr. Muth explains more.
We know that GLP-1 agonists work in some way in the brain. They take away a lot of the food noise and a lot of thinking about food, the reward that can come with food. And some people are more sensitive to those cues than others, or reward signals, to eat more. So the way that the medication works is it quiets that. So the intake of food becomes a lot less, and the motivation to eat and the reward from eating goes down dramatically. While at the same time, the GLP-1s work in the stomach to slow everything down. And so food stays in the stomach longer. You feel more full for longer. So the portion sizes, when someone does eat, dramatically decrease. And then there's other things going on that we're not totally sure, don't necessarily understand fully yet, that contribute to there being really just dramatic, more than you would expect just on decreasing food intake, but dramatic changes to weight, which this is an evolving area. There's so much more research to be done and going on, looking at the impact of the medications, also the gut microbiome and all these emerging areas that we are learning that really impact weight and obesity.
What do you think's on the horizon? What's next for treatment?
The adult world, there's all kinds of things going on. And there's more options for adults that'll probably trickle down to adolescents soon. Not to get too much into all of the biochemical names and everything, but there's the GLP-1 that has a GIP attached to it, which is a different hormone that seems to make the GLP-1 even more effective. That's already approved for adults. That has even more weight loss than what we have for the adolescents. And then there's even another one that's going to come out for adults probably in the next year or two that is even more potent and has 27% weight loss that comes from it, whereas what we have now is 17%, which is still a lot. And then you start to think about what are the implications of this, and how long-term, what is this going to be? But there's also oral ones that are kind of on the horizon. I mean, I recently read a study looking at things that are evolving for obesity medications for adults. And there's just dozens and dozens that are being investigated. And we're going to probably be having more and more approved and better, less side effects, more effectiveness that are going to be kind of on the horizon in the next few years. But that is very unlikely to be quick for adolescents, because of course you need to make sure these things are safe, effective for adults first, right? We're very careful with our children and want to be very cautious. But this is just a rapidly evolving area.
I was recently at a pediatrics conference, and I kind of reluctantly attended a lecture about weight loss drugs for adolescent. And I was honestly so surprised to hear the endocrinology expert share her experience with patients. Teens tend to lose weight very steadily and slowly on these medications, and they reach a healthy weight and just stay there. It's not like a crash diet, and they don't continue to lose weight. Case after case that was presented at the conference was just honestly encouraging. And I left that lecture impressed that there is an appropriate time when these medications, along with lifestyle counseling, makes a critical impact on a child's life. Dr. Muth shared a case of hers with a very withdrawn, maybe anxious teenager. She was very shy and sad, and she really wouldn't engage in life or in conversations even with her doctor. But as she was treated with these medications, she just turned around, and she even ended up joining a sports team, started taking care of herself. So I know with the right doctor and the right patient, these medications can be life-changing and life-saving. Dr. Muth shared more about other important pieces of a weight management plan in adolescence.
We are very, very, very strict about the behavioral piece too. We don't refill the medication if they're not doing the behavioral coaching and all of that. But seeing like as they're doing that and the behavioral piece goes hand in hand of having great positive changes that they're feeling more confident and improving like the labs and all of that, but also kind of mental health. At the same time, we have to be really careful because there is risk too. And we have to always be mindful about this of like, is this contributing to over restriction? Is there too much weight loss? Are they not eating enough of nutritious foods to get the nutrients they need? And to sometimes have to really have the hard conversations with ourselves and with the families and everything of like, should this be something that we continue at this point or not? How long does this go on for? Always really considering before even starting the medication, like what are the potential upsides, what are the potential downsides, and really keeping a close eye on that.
Are there specific side effects that you are concerned about or worried about?
Yeah, the most common side effects are nausea, vomiting, constipation, diarrhea, mostly GI side effects related to the movement of food is just much slower through the GI system and the potential of overeating or the movement going too slowly through the GI system, getting like severely constipated, that kind of thing. So always kind of mindful about that. I worry about the nutritional intake and making sure I emphasize like the quality of what you eat now is even more important than ever because you're going to eat less and you got to get the nutrients that your body needs. We have to make sure we get them in and we got to make sure that we get enough protein in. We know there's muscle loss that goes with the weight loss with these medications. And if they're not eating enough protein and doing the resistance training exercise, which you may find a lot of kids don't do right now, and they really need to, especially on these medications, they're going to lose muscle mass. And if they lose muscle mass, we know that if they stop the medication, they've lost muscle mass. Their metabolism is actually going to be slower now. They're going to gain back the weight probably, and maybe even more than that. They may not gain the muscle back. So really kind of thinking about these changes that are happening. There can be many positive ones from the medication, but there can be downsides that we really need to think about and try to mitigate as much as possible.
Yeah, there's definitely no room for junk food in that diet if you're going to reduce your calories. I have one more question, and that is, can you speak to the role of bariatric surgery in adolescents and kids? Does that happen?
Yeah. Well, before we had medication options, which was like, 3 years ago.
Right. It just happened.
Ago. Really, bariatric surgery was the only option, if you could access it, for adolescents that had very severe obesity, where you really were very concerned about the health risks from it and needed to address the weight and kind of reset that set point. So there are adolescent bariatric surgeons. There are specialty centers, not that many of them, but there are some across the country that really focus on adolescent bariatric surgery, which was indicated and needed and still is, but less so now because we have medication options that seem to be providing a similar response and benefit as bariatric surgery if they're continued most of the time. In some cases, we're learning the studies, actually the trials for adolescent is still being done to look at the long-term weight loss maintenance on off the obesity medications. But the adult studies have pretty consistently shown that if you stop the medication, your set point is not changed. You're going to go back to probably pretty close to where you had been before you started the medication.
Yeah, but it would be really interesting to see if the adolescent physiology is different, because they're still growing. Like you could potentially intervene physiologically.
Exactly. Well, they're still growing. And, they've been at an increased weight for, however many years is not that
right.
long.
3 years, not
adult,
40.
It's been decades. And so that's my hope. And that's really my focus, and really what is driving me now is like, can we have this intensive behavioral lifestyle treatment that goes alongside the medication? If we can really help the adolescents, their families, to have these skills and these tools to really optimize the behavioral pieces, when we have the support and help with the medication, which makes it a lot easier than when you don't and somebody has like an insatiable appetite. Now, okay, the medication's controlling some of that. Can we really key into some of the behavioral aspects, and so that one day we can wean off the medication, keep that behavioral intensity going, and hopefully be able to maintain the changes and have really positively impacted a young person's life so that they have skills that they can take forward for the next 80 years of their life.
We've come a long way from the days when food was scarce and survival meant that we needed to store every calorie we ate. Now, we live in a world where ultra-processed snacks are everywhere. Our biology is just not keeping up. So it's no surprise that many families are facing the long-term effects of our modern food environment. And sometimes healthy eating alone is not enough to turn things around. That's where science is stepping in. And new medications like GLP-1 agonists are offering hope for some kids who are struggling with serious weight-related health issues. They're not a quick fix, but in some people, they may be part of a broader approach. How do you know when your child's weight is something to address, though? And what can you do to support your child in building lifelong healthy habits? I dive into that in my next episode with Dr. Natalie Muth, so make sure you're following the show. You won't want to miss it. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.